By way of introducing our very special guest today, I want to share some U.S. breast cancer stats as of 2013. In the U.S., the breast cancer stats among reported cases in the white American community is roughly about 127 million. Of that number, the mortality rate is about 23%. Of African Americans, reported cases is roughly about 119 million, but the mortality rate is about 31%, which means the rate of death is much higher in that community. It's a known fact that the higher rate of deaths in the African American community is attributed to socioeconomic and educational factors. Looking at these recent statistics, the number of total deaths for breast cancer has fallen only slightly, but less than 1%. Let's face it, breast cancer is a disease that covers the globe on a wide scale with millions of women affected daily. And our global fight is to bring that number down to zero. So my very special guest is here to give us some insight in their efforts to widen their reach with women and into communities affected by breast cancer from the other side of the world. And I want to say that I am honored to have her on the show today. Ann Steyn is a two-time breast cancer survivor who held the position of president of the Reach to Recover International program in South Africa, where she was focused on addressing and responding to the emotional and educational needs of women dealing with breast cancer in South Africa. As a national coordinator of the South African RRI program, she's been able to train volunteers from 14 African countries with a grant from the Susan G. Komen Foundation. These volunteers are trained in supporting breast cancer patients and their families and also carry out breast cancer awareness campaign. In 2005, Ann was awarded the Therese Lasser Award in recognition of outstanding service and support to the Reach to Recover International program. Today, she is a spokesperson for the newly formed Advocates for Breast Cancer, affectionately known as ABC, a coalition of 7 organizations, all with an interest in breast health. She is on the advisory board of the Global Focus on Cancer and on the board of People Living with Cancer. Welcome to my very, very honored guest, calling in all the way from Cape Town, South Africa, Miss Ann Steyn. Ann, welcome to the show.
Kathy, I'm so delighted to be with you. Thank you very much for inviting me. I'm really... we feel so far away from you in many ways, but in many ways we're so close to you. And this, I think, just shows that breast cancer is something that is a global disease,
yes,
and something that we all are united together.
Exactly.
To try and eradicate it.
Yeah, and I'm excited that you said that, because even with the distance, it almost seems like, we're neighbors because, yes, of how this disease brings us all close together. And I know that you are a two-time breast cancer survivor. Can you share a little bit with the listeners of your personal journey?
Yes, I can. I first got it in 1991, so I was fairly young, and it was hormone negative. I had a mastectomy, and they decided at that time I didn't need any treatment of any sort. And I think we didn't really have the tests that they have available today. Sadly, it came back again in 2005 and 2006, and at that stage there were tests available. So I had all the tests, and it turned out that whilst I was still hormone negative, I was actually HER2 positive. So at that stage, one was able to have the Herceptin, that wonder drug. Mm-hmm. So fortunate to be able to have that. And yes, I went through, for chemo and losing your hair and your eyebrows,
Yes.
all those the things that really make
The beauty moment.
yes, dreadful. And then the radium.
Yes.
But I've come out the other side of it, and I think like most breast cancer patients, you're really a much stronger person because of it.
Yes,
And,
I agree with that.
Yeah.
So, the organization is a coalition of nonprofit groups coming together to form advocates for breast cancer. What impact is the coalition making since forming?
Yep. Well, we're a very new organization and coalition. We only really started towards the end of last year.
Okay.
And it was a result of having the Reach to Recovery International Congress was held in Cape Town last March, 2013. And we had many people from all around the world. We had 46 different countries represented. And it was such an exciting event. And we realized then that South Africa doesn't have a breast health policy.
Mm-hmm.
And we have these different groups, different breast organizations in the country, but we needed to get together to speak with one voice and get ourselves building a relationship with our Department of Health. And that's really what brought us together. We've worked very hard to establish a relationship with the Department of Health because we want to be involved with a breast health policy, which we don't have.
Okay.
We want to make certain that there is an effective cancer registry, which we also don't have. So when I heard you talking about the figures that you could give at the beginning of our interview of the figures in America, I wish I could say the same about South Africa. But
So
sadly,
there's no collated figures that you can call on to say what really?
You know, we did have a cancer register, but then it stopped. And it has started again, but it's, you know, because it's not a notifiable disease, our figures are very inaccurate.
Okay.
We do know they say it's 1 in 35, but again, it breaks down into the ethnic, different ethnic communities. With white people, it's 1 in 8, they say. With our black, in the black community, it's 1 in 25. But even that's not accurate because many of those never get diagnosed as breast cancer.
Right.
So we've got a long way to go. But we're getting there.
So what are usually the now? I guess maybe my question is, do you guys have lots of clinics that women come to? Do you have centers where they can come to get mammograms, or are these things still being set up, or they're too far between in neighborhoods and communities? How are women able to be diagnosed on or go in for regular mammograms? You know, here we have a whole sort of medical system set up where, you know, you can basically go in for a yearly mammogram after, I think now we're talking about after 40 or 45. How is the process there?
No, it's not like that at all, sadly. We do have centers where there are, you can have mammograms in the larger cities.
Okay.
But, Johannesburg, Cape Town, Durban, places like that. But in the rural areas, there are clinics that women can go to, but of course, nothing in the way of a mammogram at all. And we're divided into, you have numerous states in America. We've got 11 provinces here.
Okay.
And each province manages their own health at the moment. And some provinces are managing quite well and others are not. So the one that I happen to live in the Western Cape, we're very fortunate in that we are one of the better provinces as far as health is concerned. And so many people migrate down here in order to access our services.
Okay.
and when you've had breast cancer, you think, why should some woman be disadvantaged just because of where she lives, and really have maybe a death sentence because she doesn't happen to live in a province that provides reasonable access. So the ABC, the Advocates for Breast Cancer, is working very hard to going out into the rural areas to identify nurses and community leaders and, of course, women who've had breast cancer, and to train them in advocacy so that they are able to actually have a voice and say what it is that they need in those areas. And it's a very exciting sort of process to go out there, and suddenly you begin to empower these women, and they know what they want, and that makes it really very exciting for us.
Now, how do you get the volunteers? Do you
Originally, in the Reach to Recovery program, and it is still mostly today, all our volunteers are breast cancer survivors.
Okay.
And this makes it very strong when somebody who is a breast cancer survivor, and we are represented, our volunteers represent all our communities. So when somebody actually stands up and says, I'm a breast cancer survivor, and look at me, can you tell?
Yeah.
I look quite normal.
Yes.
And that is a very powerful message, because sadly we do have a lot of stigma about breast cancer or about cancer in general, and so we need to educate people that, for instance, it's not contagious, because many people believe it's contagious. So if you have that, you are really not allowed to cook food for the family, because you could pass on the disease. Your husband perhaps doesn't want to touch you, and you are ostracized and sent outside. So there's a lot of education that we need to do, not just in the community with the women, but also for the men,
right,
for them to realize,
right,
that it is not contagious, and that women are still women. So we're busy doing that. We also realize that traditional healers need to know about breast cancer, because for many people that's the first port of call. They go to them.
Yes.
And if we can persuade the traditional healers that, they perhaps could send them to us much earlier, that would help greatly with the preventing the late presentation, which is happening at the moment. We're seeing women coming in with stage 4, and that's sad.
Okay. Oh, all right. So how much of South Africa is the organization able to reach?
Because our the 7 organizations that make up ABC actually are found throughout South Africa, we actually are able to reach most areas, and it's spreading. It's like putting a sort of pebble into a pond,
right?
And we see the ripple
effect
beginning to spread, and the work we are doing is beginning to be acknowledged by the Department of Health, and they're wanting to work with us.
Oh, wonderful!
And that's wonderful.
Yes.
We have a meeting coming up the end of next month, where hopefully we'll be asked to help them draw up a breast health policy.
All right. And are you going to be a part of that initiative?
Yes, we would like to be a part, and we would like to also be a part of the implementation of whatever comes, so that we can see that it is implemented. And what we're really looking for is a breast health policy that's going to be equitable for all people, that's going to be accessible, easily accessible, and of course affordable.
Right.
We have a huge disparity in our country between private medicine and the public, and we need to make certain that things are more equitable.
Yeah, and here I have to say we do have very similar issues with the disparity in good healthcare services and folks who really struggle to get good healthcare services. So on that level, there is some similarity. How is the organization funded?
Well, we receive some funding from industry, but because we're a coalition rather than an organization, we don't actually have our own fundraising number at this stage.
Okay.
All our organizations do, so they can do fundraising. We have very strict rules pertaining to the raising of funds for this sort of work that we are doing. So we have to obviously, do what is correct as far as our government is concerned.
Okay.
So we're always looking for funds. One of the strategies that we're working on at the moment, as well as, of course, advocating for a breast health policy for South Africa, is a social media and communication strategy.
Okay.
Because we've realized that many people have mobiles. Even in areas where there may not be telephones, there will be a mobile. And even if they don't have a computer, they might be near an internet cafe. And so we're training our volunteers when they go out and do the outreach programs on social media and communication, because we believe it's such an important platform, because
Yes.
it gives a voice for the voiceless.
Yes.
And so we're starting Twitter and blog, particularly our blog, Facebook, all sorts of things, so that we can give information to rural areas that otherwise wouldn't receive this sort of information.
Right. So, how is when you put that together? Is it not just through social media, but do you? Is there a part of like flyers or booklets or any information that you leave within communities when your volunteers go in to talk to women?
Yes, we do. Every time a volunteer is trained, they're given a little booklet with sort of posters because some of our women are semi-literate, which first of all starts off with the anatomy of a breast and explains what the breast looks like and how it functions. And then then there'll be drawings on the symptoms of breast cancer and what to look for and how to do your own self-examination. And so every trained advocate will have that. And they also do have very simple pamphlets and booklets that they can hand out when they go out, yes.
Okay.
Advocacy as a concept is not very well known with us. So, we've got to work quite hard at it, not just with the people, but also with our medical profession, because they sort of think that, you're going to be a strident person coming along and demanding all sorts of unreasonable treatments and things like that.
Right.
And we're not. We're really just wanting basic, good breast health care for everybody.
So now that your group is getting together to put a policy together, do you guys have a template for that, or is it information that you're pulling from other areas, other countries?
Moment it is. We're using the Breast Global Health Initiative. Do you know?
I've heard of it. Yes.
Yes, that's absolutely wonderful, and I was very fortunate to be involved with that. It's been going for about 10 years, and it's worked out. It works on a low income and then a middle income, and so it will have the basic level that is required for a breast health policy, and then maybe if you move up a strat a little bit, it's limited, and then it goes up to the premium level. So we realize that we can't have MRIs and things like that. It just wouldn't work in our country. It's got to be financially available. But we do have those booklets, and we are drawing on them quite considerably.
Okay. Now, I know that there was the conference last last year, the Breast Cancer Support Conference that was held last March. Is the ABC group going to be represented there this time as a group, or is it going to be separate as you were last year?
I hope that we'll be together. The next conference, they're held every 2 years.
Okay, it's every 2 years. Okay.
Because the Reach to Recovery program is actually found in over 100 countries in the world.
Oh, okay.
So the next time is going to be in Beijing.
Oh, my.
Yes.
Okay. So you may be getting to travel.
So we will hopefully be able to, again, need funds, but to bring some of those patient advocates that we've trained would be wonderful if we could have them at Beijing telling our stories. Mm-hmm. And we're hoping to put our stories onto our blog in October. Mm-hmm. And we have got funding for the blog that's going up until the middle of December. And so we'll do it daily throughout October with stories about women. Then I'm afraid in November it won't be quite every day, and then we're running out of money in December. But we're ever hopeful that we will get some.
Mm-hmm. Yes. So how much progress has the group made since last year? I know that you guys just started, and there's a lot of work to be done. Do you feel that you're making some inroads into the communities that you cover?
Yes, it's actually quite exciting, Cassie. You suddenly, you're hearing people talking about advocacy. Mm-hmm. You're hearing volunteers and members of different organizations coming together. Only last week I was up at Grooterskloof Hospital, which is our very big tertiary state hospital in Cape Town. Mm-hmm. And there were, I suppose, about 15 of us, and we were from quite different groups, and we've all come together to try and work that is just in that particular hospital, but we're trying to collect money so that they can give more time to breast cancer operations, because at the moment they don't have sufficient time slots. You have to pay for them. Oh, so we're collecting money to do that. And it's, as I say, we're different organizations, and all of a sudden there's the realization that if we want to achieve something, we've got to get together and speak with one voice.
Right. So you being the spokesperson, do you coordinate all the other organizations when you need to pull together a campaign outreach? Are you that person, the go-to person to pull?
Well, yes and no. Mm-hmm. People can come to me, but then we do have a project manager who will manage it, mm-hmm. because we've come in under another umbrella called the Cancer Alliance. And we're the breast cancer mm-hmm. component of mm-hmm. that Cancer Alliance. Yes, we fit under there, and we get on very well. It's so exciting, because up until about 2 years ago, we all were very sort of territorial about our own particular turf. Right. And now we realized, no, we can't be like that.
Right, it just makes sense.
We all have the same aim, and that is we want the best quality care, breast cancer quality care for women. Right. And we must get together.
So, what are the ways that our listeners and folks in your area can get involved with advocates for breast cancer? How can they find out information and get involved, and probably help funding?
Yes, well, that would that would be absolutely marvelous if they did feel like that. There's a Facebook, mm-hmm. which they can always go on, and that's called Advocates for Breast Cancer. Okay. Then we also welcome Twitters mm-hmm. at Breast Cancer ABC. Uh-huh. And then we have our blog site. Mm-hmm. And then Cancer Alliance has got its website, and I'm certain that there would be programs there that might interest some of your listeners. Okay. And we would, we'd be very excited if we had some assistance.
I'm going to share. I'm certainly going to share that information on our website, and our Facebook page as well. And is there anything that you would like to leave our listeners with about the work that you do, your journey, anything that you want to share or leave with our listeners as we close out our segment?
Well, I guess it is just something that everybody knows, and that is that breast cancer just doesn't discriminate.
That is
anybody
true.
can get it. And it's something that you cannot ever believe that you'll get,
Mm-hmm.
but it's quite prevalent in our country,
Mm-hmm.
and we need to be aware. And I would just love to say, to all your listeners that we in South Africa and in Africa, because we've done quite a lot of work in other African countries. We look to you because you are, in many respects, a leader in what you're doing. But at the same time, we in Africa are aware that we need to find our own answers to our own situations.
Okay, great. I think that's wonderful. And like I said, I want to be able to share that information on our website so that our listeners and our Twitter and Facebook fans can stop in and see what's going on the other side of the world. And I want to thank you again so much for your time, for sharing this important information with us, especially since you're halfway around the world. And I'm glad that I didn't wake you up.
No, you didn't. I hope I didn't wake you.
And we're hoping for tremendous success with your endeavors with Advocates for Breast Cancer. And I would love to follow up with you in the near future to see, what progress your organization is making in regards to this very important initiative.
We talk, I could tell you about our silicone prosthesis project that we're doing for women who can't afford to buy one.
Okay. Well, I'm going to make a date. I'm going to make a date for that. So thank you so much for being with us today. And I look forward to following up with you in the near future on how the group is doing. Thank you again for your time.
Thank you so much, Cassie, for having me.